And even as we get into a conversation, our guest is seated in the hot seat this morning. Dr. Supa Tunje is the president of the Kenya Paediatric Association. She's a pediatrician and neurologist in Machakos County. Dr. good morning.
Good morning.
How are you?
I'm very well, thank you.
Karibu sana.
Asante.
Good to have you here. A Healthy Friday conversation looks at some things that maybe sometimes we don't know enough about or we don't get enough information about. So it's good to remind us about some of those things. I'm very glad that you can do this with us this morning. We're going to welcome you to the Situation Room this morning with a proverb. Dennis will tell you where the proverb is. We'd like to get your interpretation of the same.
Mm-hmm. And we are in a country who got its independence in 1962 from the Belgians. They have a majority of its population at two ethnic communities, the Hutus and the Tutsis. The capital is Gitega. You know the country?
The capital is?
Gitega, formerly Bujumbura.
Bujumbura.
Yes.
That's Burundi.
Burundi, yes. So today we're in Burundi. And the proverb from Burundi is, haste brings waste. How would you interpret that?
Haste brings waste. Haste brings waste. So it's if I was to interpret that as anything that is done in a hurry may not achieve its purpose. So that means if you do anything in haste, it's not going to achieve what it's supposed to do. I think that would be my quick translation. Yeah. Not very good in proverbs.
Well, it's okay because your opinion is what matters here.
Yes.
Yeah. Anything that you step into really quickly then will essentially, without you looking into what it could be or mean. Within time, then could bring about waste later.
Yeah.
Okay, so those are some of the things that we look at. Then we're going to get into a field where we know that you're good at, and so it's not going to be too much of an issue from here on out. So just a little bit of uncomfortability, and then we get into it proper. So obviously, we are looking at our Healthy Friday conversation today looks at 3 diseases. It also looks at their vaccinations. So probably going to look at the importance of them as we go along. And we're looking at 3 big ones. And we want to get into that a little bit. Measles, rubella, typhoid. Can you give us an overview, first of all, of these 3 and tell us what are we looking at in terms of severity, footprint around the country, especially for one of those measles where in other parts of the world, this disease has been completely eradicated. So maybe you can start off with you.
So let me start with measles. So measles is a viral infection. Mostly affects children. And some of the symptoms, as you had mentioned, include a fever. And then you find a baby develops a rash after the onset of the fever. They also have eye changes, so they appear to have red eyes. They may also have complications. They present sometimes with signs and symptoms of pneumonia. But when it is complicated and advanced, they may have some symptoms involving the brain, and that includes, we call it encephalitis. So they may present with symptoms, confusion, sometimes convulsions, and it's a viral infection that can affect a child from any age. Then when we look at rubella, it's also, the other name is called German measles, and it's similar in terms of the presentation to measles.
Oh, okay. So it's not chickenpox?
It's not chickenpox.
Okay.
Chickenpox is a different viral infection. So rubella is also a viral infection. But the most important thing about rubella is that it may have if somebody is infected with rubella, later on in life, especially for the females, they may have a problem, especially pregnant women who may expose their fetus to the infection. So if an adult, a pregnant woman, gets rubella, the baby may be at risk of birth defects, but the other thing is that it can cause pregnancy losses. Now, if the baby survives, we see some of the effects include the heart defects, so they can actually have what we call holes in the heart. The other thing is that they may develop deafness. They may also present with the eye changes. There's something we call cataract, so we may see that, and so it's a deadly disease. So if it doesn't cause death, then it causes the defect, malformations, and sometimes it's fetal losses. While typhoid is a bacterial infection, so it's mostly transmitted contamination through food, water sources, and sometimes it's just our sources in terms of drinking water, cooking water. And this typhoid will cause a systemic disease. That's what I may simplify it that way. And the symptoms are similar to other infections. So it will cause fever, general fatigue, you'll have a headache, sometimes abdominal discomfort. Other times you may have either constipation or diarrhea. So when you look at those symptoms, they may look like any other infection. And so it can be sometimes difficult to make a diagnosis because it can present and look like it's malaria infection.
Oh, right.
Yeah, but Dr. as we have this discussion, there is also the aspect of with all these diseases and how they look like, they are detrimental to the healthcare of children. But then again, the things that can be avoided, right?
Absolutely. So we can avoid these infections. Why? Because the first thing that we promote in child health is hand hygiene. So clean and safe water to start with. So whatever water source that you have in your homestead, you mentioned like typhoid. For measles, the transmission is through droplets. So it goes to hand hygiene. If somebody is having an illness like a flu-like symptoms, they need to make sure that they cover when they're coughing. They should be able to cover their mouths and also cover their nose when they're sneezing. So those are some of the preventive measures that we promote. And by just applying those measures, we significantly reduce the transmission of the diseases.
So you are a pediatrician.
Yes.
You're a neurologist as well. We want to then be able to... you talked about measles affecting the brain,
Yes.
right? So obviously, neurology comes into play here.
Yes.
So you taking care of children at the medical in the medical space. Tell us, do we see that we are still seeing? First of all, how you got into this in the first place, and then tell us how we are still seeing the footprint of a disease like measles. Measles seems to have been around. I mean, when I was a child, there was measles. When my parents were children, there were measles. There's still measles till today.
Yes, and that is because of some of the gaps that we have in vaccination coverage. I'll give an example. Just about 6 months ago, I came across one of my patients who had not received the measles vaccine. So this child happened to have traveled to a neighboring country, and while in that country, they developed the symptoms of measles. Now, he was treated. He was about 4 years old. He was treated for the acute illness, but then when coming back to the country, they started getting the complications, and they presented with symptoms of now what I call measles encephalitis. So he had this rigidity. He was a bit spastic, posturing, and with reduced level of consciousness. So measles is still there, especially those who are at risk as those who have not been vaccinated. But even when we look at our vaccination coverage, we also have a few who may not develop like adequate levels of antibodies in the body when they have been given this vaccine. So there's a small percentage that may not develop the full immunity after vaccination. And so it is very important for us to make sure that all children are actually vaccinated for you to eliminate the disease.
So, there is a case, obviously, for vaccination.
Yeah.
Is it possible to get any of these diseases even after having been vaccinated?
So the risk of infection reduces significantly following vaccination. But we also say that after vaccination, we still apply the other measures. So it doesn't mean that when you have received typhoid vaccine, so you can drink any kind of water. So we say that you need to also just apply other preventive measures. However, vaccination gives up to 90% protection to the child. Once you develop the antibodies, it should protect the child against the disease. And this protection, at least for typhoid, for example, it's up to 5 years. It will provide protection against the disease. So yes, vaccination should prevent infection.
Yeah. But even as you talk about vaccination, because you said it reduces significantly, but a parent sitting somewhere is asking for me to just be sure, because there is that percentage that I'm not certain of.
Yes.
Can I take a second dose, or is it just a one dose fits all?
So this is usually the scenario. And when we talk about vaccine protection against disease, it varies from disease to disease. When there are some vaccines, you get a single dose and that protects you fully for a long period of time. One good example, for example, is the yellow fever. We take it, and we used to get a booster after 10 years, but now it's been shown to give lifelong protection. So there are a number of them that you just need a single dose. However, there are some, for you to have a full immunity, you may need multiple doses. And in this case, typhoid is going to be given as a single dose. It should induce adequate immunity that will cover you at least for 5 years. For measles, we have been giving 2 doses, so one at 9 months and another one at 18 months. So that the second dose acts as a booster, so it induces more immune response in the body, so that ensures that you're fully protected.
So how is it charted for medical professionals who decide, maybe this is obviously why you're here, for us to then understand the intervals at which you give these vaccines? Like, I remember that, you have your baby, and the before you leave hospital, the BCG is done. And then they're gone. Then after that, 6 weeks, you get the first ones, like that. How do you decide? How do you know then at what interval? Like, for example, you talk about measles, rubella. You start at 9 months. Why? Why 9 months? Why not 6? Why not 3? And then the booster after 18. Why?
So the scheduling of vaccines depends on the risk of exposure to the infection. So one, we know that breastfeeding offers protection to the newborn, and this is the baby is able to get antibodies that are protective from the mother. However, there are some diseases that the exposure, because of the burden of the disease in the community, the risk is higher in terms of exposure. And so something like BCG, tuberculosis, is in the community. So you want to make sure that you provide protection as soon as possible. Polio, the same. So when we schedule, it's based on what is the risk of exposure at what age. But also the other factor is the fact that a newborn compared to an older child, in terms of how their capacity to be able to induce immune response depends on the maturity of the immune system. And so if you give certain vaccines much earlier, they may not induce an immune response to the child.
So there are vaccines, right? And it is being given because they are safe. But then we live in a community where everyone seems to be doubting everything. Then there is also the society that we live in, the religious beliefs that we belong in. So, vaccine, government. So what assurance are there for parents that these vaccines are safe? What are some of the safety measures that your profession, together with the government and other institutions, are put in place to just give that extra assurance that bring your child, they will be safe, and this is equally meant to just make their lives better? So
I think it's just a normal response for anybody, if something is new, you want to be very certain that this is good. And indeed, for us as doctors or pediatricians, the safety of the children, but also their wellness is of priority to us. So we ensure that whatever we are making recommendation to a child is first safe. Why? Because children are not able to determine for themselves. So it is us to ensure that whatever they need to receive is actually of good quality and it is safe, it has been thoroughly checked. And vaccines, if I can just explain to the public, is one of those products or molecules that you can be sure that they undergo a very lengthy process when it comes to its production. So right from the beginning of getting to identify what kind of products will be required to be put into a vaccine. So there are quite a number of steps that are taken. So we can be certain that the production of that particular vaccines, by the time it is being given to the community or to the child, it is actually has undergone all the safety measures. But at the same time, during the administration of the vaccines, we also ensure that everything is followed, including how has it been stored? Is it still in the same state as it's supposed to be until it reaches the child? Yeah.
Are vaccines safe? And I ask that question knowing full well that you've already said that vaccines protect us from disease later, or at the very least reduces the severity of a disease should you actually contract it. But are vaccines safe? Because essentially what you're doing is that you're taking, and please stop me if I'm wrong because I'm a journalist, I'm not a doctor. If when you in a vaccine there is an element of the disease in that vaccine, so you're essentially injecting or you're introducing this disease and asking the body essentially to fight it. Are they safe in their makeup? And then do we see that there are harmful effects or side effects from the administration of these vaccinations?
So right. So what you find in vaccines have different formulations. So we have what we call live attenuated. So live attenuated means it's not the actual virus or bacteria.
Okay.
So it has been formulated to mimic the actual microorganism. However, it is not the real microorganism.
Okay.
So in that case, it should be able to be recognized by the immune system that this looks like the virus, and so the body then will be able to induce an immune response. Okay. But then on the other hand, just because it mimics the actual organism, then we get to experience now what we call some of the side effects. Okay. So but those side effects, some of them, what we detect as side effects is actually part of the immune response reaction. Like if, for example, you get measles, what we expect is you'll have fever, you can have a rash. So in certain cases, you may find now you're developing, but to a less extent, some symptoms that are mimicking the actual infection. But vaccines are safe because whatever components are put in there should ensure that they're not going to cause excess immune response that now becomes an adverse reaction.
Okay.
Yeah.
So then what happens when you have, and I see this question coming because it was just in my mind as well, because we're focusing on these three diseases and their vaccines, but then looking at vaccine as a whole, and we're going to come into government response in a bit. But then I remember my son, and there was a particular vaccine, and I think it's the same for a lot of folks. There's one, I think it's the 6-week one, I'm not sure.
Pentavalent.
The poor guy cried the whole night. And we were told that was the baby-friendly one. So now I shudder to imagine what happens when it's not baby-friendly. So what are the differences? Because from the symptoms that you're talking about, that the body now is fighting, giving an immune response to this thing. so you feel the symptoms for a little bit as this little baby.
Yeah.
But then what happens when you have a vaccine that's quote unquote baby friendly? Has something else been added to it?
So let me just demystify that the vaccines are the same.
Really? So they lie to us?
Not really. In terms of, they're the same in terms of their effectiveness. Okay, so the difference may be, and in this, the one that you're referring to is the pentavalent. It has several components in one, and the difference is in one of them. And it's just the way it is prepared is slightly different from the other one, and it's the pertussis part of it. So again, why the baby may cry, there are various reasons. They may cry because they have developed a slight fever, but also there is a pain of the injection. And the pain may be because, to maybe a lesser extent, the technique of the injection, but the components themselves may cause a slight reaction. So some inflammation around the site. And that is also part of what you might expect in some of the vaccines. So in terms of effectiveness, they induce the same response.
Okay. We're also looking at a time where right now there is the insistence on the vaccination for these 3 diseases. And so we want to ask the question, is there something going on in the atmosphere that we should be aware about? We're looking at typhoid, measles, rubella. There's a vaccination campaign in Kenya, but we're trying to understand a little bit more about these diseases and how they present. And so that's the question that we say, okay, vaccine. There's the campaigns around the world, anti-vaxxers who say, well, look, all you're doing is poisoning us and people are dying. There are doctors who are saying that there are lies that are being peddled about vaccination and why it's important, where you can just be a healthy person in the environment and that you'll be okay. Do these diseases, these 3, typhoid, measles, rubella, pose a significant threat to life without the element of vaccination in the community today?
So, measles. I think I had explained earlier that measles has a range of presentation. So, but the worst of them is that, yes, measles can cause death. So, it can present as pneumonia. So, the child will come, has fever, they may have a cough. The rash is just a sign of the infection. But then it can cause the complications, as I mentioned, the encephalitis. Encephalitis just means an inflammation of the brain tissue. And this will present with loss of consciousness, in certain cases convulsions. They may have persistent fever. And one of the other things, why we are talking about causing death, but if death does not occur, it has lifelong morbidity, so disability. And this is 10 years or even more that a child who has had measles before may develop what we call epilepsy in future. And in this epilepsy, they will start to have convulsions. And this kind of convulsions can actually be progressive. So where the convulsions are not responding to medication. So when we look at measles as a disease, it's not just the acute infection. In the long term, there is a condition that we call encephalitis that can come 10 or more years later. So the child who was exposed was an infant. Years later, when they present to us with epilepsy, and when you trace back, had not been vaccinated, had measles, and now they're presenting with convulsions. So yes, they are deadly diseases. Typhoid, on the other hand, is a condition that will keep recurring. I think a few people may have experienced these symptoms, and you're not very sure, is this amoeba or is it typhoid? So frequently you get it recurring. And typhoid, you can actually be a carrier for as long as a year. So you might have symptoms, you may not have symptoms, but the risk in the community is that somebody who has typhoid could actually not have symptoms, but they will be infecting others. And those and that means it can cause outbreaks. So that is why it's important to vaccinate, so that then you don't put a risk. So even if you do not have any symptoms, you have no fever, you feel like you're okay, you could actually be carrying typhoid in your body. And as long as the rest of the people are not observing hand hygiene, they are drinking contaminated water, they'll get infected with typhoid. And that can cause an outbreak in that community. So the vaccines are important because we need to make sure that we prevent the spread of this, and because of the outbreaks that are frequent. Yeah.
So we talk about, let's focus on measles for now, in terms of my child comes back home from school, has measles, take them to the hospital, they're treated, voila. But where it started from, we've not traced it back. So how contagious is measles?
So measles is highly contagious. As we know, it is transmitted through droplets. And you see, measles presents like any kind of viral infection. So you'll have some flu symptoms, maybe a bit of running nose, there's a bit of cough, the fever is there. So as before even the rash occurs in the body, if that child is within, like in a classroom or at home, they will already expose the virus to the rest. So by the time there's an incubation period, so by the time the other person is getting the symptoms, you've already spread it to others. So it's really highly contagious. The same to rubella, similar to measles. Typhoid, on the other hand, is if you do not observe hygiene, and somebody, even a food handler, and you go and buy food on the street or wherever, and sometimes it's even in decent restaurant. I mean, as long as the one who was preparing the food had the infection, they don't look sick. They will actually expose to the rest.
Okay, so usually when we hear that there's a campaign in a city, wherever, for folks to come out and get vaccinated, then our next thought jumps to, okay, then there must be some kind of infection in the community. Is that true right now?
Actually, in the last few months, we have seen some rising cases of measles within the counties. Just another, like a couple of months, I had almost a 3-month-old who presented with signs and symptoms that looked like measles. Okay, so when you have this campaign, it's because you have when through surveillance structures, you identify that there is an increasing number of cases, and this is not just perhaps a single case like in cases of polio. If you see one case of measles, you probably have 20 already around them that have been exposed. So in the last few months, there's been an increasing number of cases of measles. About over 20 counties have registered some cases, and this is cases that have been tested and confirmed to have measles. For typhoid, we have had this exposure in some subtle outbreaks, especially in certain informal settlements, but also increasingly we are seeing this. There was a study that had been done over a long period of time that has demonstrated that there has been typhoid present in the community, and we've not had the opportunity to be able to vaccinate against it.
So we talk about rising cases in communities, then it goes back to the availability of the vaccines in the country. And we know international partners have pulled out their funding to would-be developing countries, which begs the question, could the amount of rising cases of these diseases be tied to that? And then availability of vaccines in the country, and perhaps now what are some of the interventions in place to ensure that we don't find ourselves here? Well,
that could be one of the factors, but the other factor is the fact that we have not been able to achieve the expected coverage of the vaccination. So, for example, to be able to ensure that the community is safe from measles, you need to vaccinate at least 95% of those who require the vaccine. So we have not reached that level, and that's why then the ones who now have not been vaccinated, when you have an infection, then it's easy to spread it. So that's the other factor. And in fact, I think that's the most significant factor, that we have not been able to achieve our vaccine coverage in the country up to that level. And for those who have been vaccinated, we have also observed that majority take their children for the 9 months. But the 18 months, which is a booster, the coverage goes lower. So that's the other risk that has been in the country. That mothers, they take for their first dose, they're happy. Once the baby reaches 1 year, they think now vaccination is over, and they forget to take the children for the 18 months booster.
Okay. So if you expect it to do 90%, what percentage are we doing at the moment, if you have the stats?
Currently for measles, because it's an average, some counties are way below, while others have been able to reach up to 90. This we call fully immunized. So fully immunized is a child who has received all vaccines up to 18 months according to the schedule. So on average, we are still below 90%.
Okay.
Okay, so the cost of actually going in and get the vaccine, I don't mean bringing them into the country. I mean you with your baby going in and getting it. In some cases free, in some cases charged. What are we looking at across board? Because bread and butter issues, Dr. I mean, imagining that my child is healthy as I'm seeing them here, and I'm thinking about food on a daily basis and all these other things that I need to do, and then somebody is asking me to go and get medication essentially for something that my child is not sick for. Do you see it may not sound logical, but for the person in that situation, it is absolute logic. So what's the cost, literal cost of getting these vaccines? Getting your child vaccinated.
So the good thing about vaccines is that they are available to our lowest facilities in the country. So that means vaccine should be accessible to your nearest facility in the community. If that is not, assuming, I know there are some areas that are a bit far off from the health facilities, there are activities, outreach activities that are done on a regular basis. And on a monthly basis, if a child missed a vaccine, it will be brought near them within the community. So I know this in some counties have been able to establish regular outreach visits, and they get to the community and vaccinate those children. And so for those that are far to reach, I think the government has put in some efforts to ensure that they reach the last child.
So is it free?
Yes, it is free.
It is free.
Yes.
So you actually spend nothing.
You don't
At least for these
money.
3 that we are talking about, you spend nothing except for maybe finding your way to the facility. You spend nothing to get the vaccine done.
There is no cost, and the strategy right now, according to what has been organized in the campaign, is that these vaccines will be available in health facilities. There will also be some temporary vaccination sites within the community, in the markets, in any public place.
Schools.
They are going to take to the community, to schools. So essentially, it's just making it accessible to everyone.
And so what is the length or the period of a vaccination campaign? Do you say we're going to do it for 3 months, we're going to do it for 6 months, or do you stop when you see that the burden of the disease has started to reduce in communities? How do you schedule that?
So the duration of the campaign is essentially based on
when
the
the thing runs
logistics
out.
and in terms of how many children do you hope to reach. Okay, so it's not necessarily that you will see the cases dropping suddenly after 1 week of so it's just based on what is the target population in this campaign. So some campaigns have lasted a week.
For years, like we see with polio.
Others will just be over weekend. We're doing this exercise, especially if it's just being done in one county. So it's easier to reach everybody. And it just, but the period is given so that even the hard to reach areas will be accessed.
But there's there's some that just keep going on and on and on. And I know we're not talking about polio this morning, but I mean the polio it's all the time that we see somebody's in the estate walking around polio. The school sends something and says it's a polio vaccine all the time. Does it, because we see the prevalence of it in society, communities?
So there are different kinds of campaigns. So like this particular one that is happening is because typhoid is being introduced into the routine immunization schedule.
Right.
So after this campaign, of course, vaccination against typhoid will continue. So babies will still receive just like the rest of the vaccines. But sometimes you find whenever, like for diseases like what you have mentioned, polio, anytime there's a case identified, a mop-up campaign has to be done.
Okay.
Yes.
Yeah. So when you talk about accessibility, there is also the subject of availability. And one, I now want to get into where our local capacity as a country to be able to manufacture our own. Because this would mean, because today if you talk about vaccines, you have to import and whatnot. But is there any, from where you sit, any move by the government to research and develop these locally, so that when you talk about 90%, we are able to mop up these vaccines and distribute them? Are there any plans? Are there conversations in the rooms that you belong in?
So as an association, we have been continuously advocating for consistent supply of vaccines in the country. Why? Because anytime we have a gap, then we risk like exposing the children. So from our engagement, especially with concerned entities in the government, I know there has been some plan to see whether we can have manufacturing of the vaccines in the country, and I think the technical capacity is there to be able to do that. However, the government needs to intentionally be able to heavily invest in the infrastructure that is required to ensure that when you're going to produce that vaccine is actually a safe vaccine. So there's a lot of investment that will be required, and I think to some extent the government, in our own engagement with the ministry, there has been indications that the plan is not just for vaccines alone, even drugs, and we've already seen that you can manufacture a number of drugs in the country, but for vaccines being the kind of requirements that are needed to ensure that you produce a safe vaccine much higher than maybe any ordinary drug. And so it would require a lot of investment to make sure that it's always available.
In the current campaign that is starting tomorrow, what numbers are we looking at? How many children are we looking at vaccinating?
The target is almost about 22 million children. So higher number for the typhoid, up to maybe 19 million, because you're vaccinating typhoid from 9 months to 14 years, while the MR vaccine is going to be 9 months to 59 months. So it's a huge campaign. I think.
Just doing the count, 59 months. I was like, how
59 months is about 5 years.
5 years old, right?
Yes.
60 months, 5
Slightly
years.
before, yeah.
So, where do vaccines come from? Where do vaccines that make their way into Kenya come from? Who is, number one, manufacturing them? Who's distributing them? Under whose auspices does Kenya get its vaccines from?
So, well, I may not have the specific manufacturers, but there are different manufacturers. And I think if you recall, during a COVID period, we had different vaccines coming from different companies. Okay? So, that is to say that vaccines don't come from a specific country or a specific manufacturer. So there are different manufacturers of vaccines. For these ones, I may not be privy to where the contract came from. However, the process is the government procures the vaccines, and it's currently the country is still co-financing for the purchase of the vaccines. So part of it is still funded by Gavi, and part of it is still the government. So they just go through the usual procurement process from the different, depending on which vaccine that you're procuring. Yeah.
So while administering these vaccines, there is the aspect of acceptability with the public, because you come with your vaccine, sour, but then again, one would want to see, first of all, the sense. One would want to understand the need of having these vaccines, because unavailability of that information would make someone just go about their business and not see the need of that. So in terms of capacity building, in terms of civic duties, making sure that the public understands this, where are we? What are you doing to ensure that the public knows the need?
So, learning from past experiences of these campaigns, and generally looking at the evolving, the landscape has been changing in terms of acceptability, especially for vaccines. Now, as an association, we have made a commitment to ensure that children will get vaccines on time and at the right dose, in terms of if the child needs 2-3 doses, they get it complete. And ours is to advocate for parents to ensure that their children are fully vaccinated. Now, we have provided platforms where we have engaged with healthcare workers, first of all, to make sure that they also understand the vaccines and the reason behind the campaign. But we have also had platforms where we have engaged with the public, and this is on social media platforms, just to bring an understanding on why this vaccine, what is the importance, what is the burden of the disease in the community, what is the cost effectiveness of, when you compare to treating the disease versus the cost of the vaccines. As we said, the vaccines are being given free. However, if your child falls sick, you will go to the hospital and you will pay for the treatment. Okay? So when we try to engage with the public, and I know the government has also had a number of sensitization forums. We have engaged also as a professional body. We have engaged with our colleagues in health, just to make sure that they also understand, because I know the hesitancy is not only, I'm also a mother, I have my children, do I want them to be vaccinated? So that information is across, whether you're a health worker or you're general citizen. So we have ensured that we are passing this message to as many as can hear us.
I hear you. And in as much as we're looking at medical physiological issues here, when it comes to the protection of healthcare, we cannot run away from the political aspect of all of this, whether it's politically for a nation or global politics. So even as we wind down this conversation, there are messages and that are backed by scientific fact on both sides. How do we debunk what we hear, that vaccines are poisoned, that they are not safe, that vaccines are the agenda of other nations to either subdue, control other nations? These are true conversations that are happening in public spaces today, and that have an effect on whether a mother and father will take their child for vaccination. That, on the other side of scientific fact, could change their life. How do we operate safely in a space where both of these conversations are happening?
That is true. There's been a lot of conversation around vaccines. And just as they said, vaccination is always a topic of interest to everybody. And while we are championing for the vaccines, we are very much aware that there could be other political issues happening in our country and even regionally and sometimes globally. And that usually, yes, has an impact on the uptake of the vaccines. However, I think with when we look at vaccination as an intervention in public health, it's one of the cost-effective, is cheaper than treating any disease. And just that understanding that it actually saves the population from threats. And these threats are real. Because if you have been in an outbreak, I know we have deadly diseases where we don't even have a vaccine. Maybe Ebola, you could have other yellow fever, hemorrhagic. Yellow fever, we have a vaccine. But when you have a vaccine available for against a disease that can be prevented, then it is upon us as a people, as a country, to make sure that it is available and it is given to the population, the target population. I think sometimes the misinformation that's out there is because when we see vaccines are only given to children, it's going to affect their... In fact, giving vaccine to a child is to give them a healthy future. It's not to damage them. It's not to interfere with... I know sometimes there are conversations about, they're reproductive. I just mentioned that rubella, for example, will actually affect, as an infection, as a disease, is going to affect our generation. So if a pregnant woman gets rubella and had not received a vaccine, then it's going to actually interrupt the generation, because they will lose the babies. And even if they get the babies, then they're going to get babies who have malformations. So when we look at the bigger picture, is that vaccines are actually supposed to protect the community.
Dr. Supa Tunje is the president of the Kenya Paediatric Association and has been our guest this hour, and also a paediatrician and neurologist from the Machakos County. Looking at the vaccination campaign that's taking place between the 5th and the 14th at a school, church, hospital, medical facility near you. Come out and get vaccinated for typhoid, measles and rubella.
This is the Situation Room, the only way to start your day.